Hello everyone, welcome to the Voice of Nursing. My name's Adrian Tracy, I'm the CEO of ICG Medical. Today we have our first Australian Voice of Nursing episode coming, and welcome Lee Garwood to the Voice of Nursing, Chief Executive of Brunswick Private Hospitals. Welcome Lee.
Thank you very much. Hello.
Lee, tell us how you got into nursing.
Well, I became a nurse in about 2006. I was coming towards the end of my school journey and thought, well, what am I going to do? There's a long-standing history of nurses and pharmacists within my family. So my mum's a nurse and a few other nurses in the family. So I decided, well, it seems like a logical thing to do. Pretty caring in nature, so the logical step was to go into nursing. So I did my diploma of higher education at De University in Leicester, and worked for the University Hospitals at Leicester before transitioning to London. Then after that, I took the bold step and moved to Australia in 2008.
How come you moved to Australia?
Oh look, I came over as a kid with family and fell in love with the place. The climate is fantastic. It's very different to the UK. It's a lot warmer here. Except since I've moved to Melbourne, Melbourne's very much like the UK. It's 4 seasons in one day, which kind of makes it interesting, but it's definitely on the warmer side.
And talk us through the step from being a nurse in the NHS, then moving to Australia. How did that come about? Did you have to do any qualifications or any change in registration?
Yeah, I think I moved at a time where nurses were in critical demand, and they are still very much in a much needed roles here. But at the time that I applied, there was a as well.
And talk us through obviously you went into that private sector 12 years ago, and that was obviously as an RN. That's still as a nurse, and then moving that career up to the CEO today, because that's a really fast journey to go from that sort of hands-on then to be that CEO position.
Yeah, when I moved over to Australia, I came in as a registered nurse and then moved to a clinical nurse, which I guess would be a in the UK terms, a band 6.
Okay.
And then progressed to other roles, which took me into band 7 and then band 8 roles equivalent, so nurse management roles. As I've worked in different private departments, I've then been able to work on build projects, so taking shells of sort of old hotels or old buildings and actually turning them into hospitals. I've been involved in setups of digital-based hospitals, which are opposite universities. So I guess for me, I've had really, really good opportunities and to sort of step into some roles that probably aren't the normal, the norms of being a nurse and providing that direct patient care. That then led me into much bigger roles to the directors of clinical services at a regional location, and here in Melbourne in the hospital that I'm currently in now, and then progressing to the CEO approximately 18 months ago.
Fantastic. And from the point of view of the management skills, was there training around that? Or was that something, because we always talk about how we're always amazed about the soft skills that all nurses seem to have, how they manage the patient but also manage the family, and then going into actually managing nurses on top of that.
Yeah, I think there's not always a role that you step into that you have all the skills. And I think I've been very, very lucky along the way that I've had some amazing mentors as I've stepped up into roles and finding the right ways of doing things. And sometimes you have to learn those skills on the hop, and you learn how to not do things again. But also you have a great support network around you from other managers at your peer level, your seniors as well. And I think the mentors that have mentored me along the way have been invaluable, and I certainly wouldn't be where I am today without those. And that's something that I try to get with my team. So I have 25 direct reports that I see on a daily basis. So it's important to schedule some meaningful time that you can sit down and debrief together, work through problems, but also give that positive feedback as you go as well. As I always say, it's saying thank you is sometimes something we forget when we get busy. So it's important to catch up every now and again and just recognise that hard work your staff go to every day.
That's great leadership. And what would you say the sort of most challenging or interesting part of your role is now?
Well, no one day is the same, and I don't think you ever stop being a nurse, even as a CEO. There are often times where, if my second in charge, who is the director of clinical services, isn't on site, you automatically assume that covering role. So I think it's that juggle between the financial, the non-clinical, and then the clinical operations of the hospital. But I think as you become more experienced in these types of roles, you learn how to allow your staff to go and do things, and they come to you for advice. And it's knowing somewhere between knowing when to assist and when to just let things unfold and let them come to you. That's the hardest challenge.
And you spoke earlier about some digital work that you were supporting around digital hospital. What are you seeing from a technology point of view and the influence of that within the healthcare industry there? Yeah,
there's a huge amount. I think the age of, pen and paper are starting to slowly fade. Hospitals are very much built on a paper-based system, but there are certainly digital innovations. Some of the things that we are now doing is recording patient data outcomes and uploading those to our patient administration system, which then feeds into an Australia, New Zealand-wide research database. So we can now track a variety of patient improvement data, and we can actually say, well, how are we doing within our hospital? How are we doing against our peer hospital within our hospital group, because we're a part of a 37 hospital-wide group, and how are we doing against our peers across Australia and New Zealand? So those are the types of things that we are trying to look at to improve our patient experience. Because we also deal with private health funds on a daily basis, we have to produce certificates and confirmations that the patient has received the care that they were expected to provide, so what we call a rehab certificate. And we do all of that digitally. And when we're going out into hospitals and reviewing patients to determine whether they're suitable for admission, we ask our rehab assessors to complete it on an iPad. So similar to this iPad, they would go out and see a patient, complete everything digitally, and then it would just upload into our system. We can say, yeah, they're suitable for service, and we bring them across. A lot of what we do in terms of our outpatients is reasonably digital. We have a Parkinson's disease program to help patients improve functionally. And we have iPads at the patient's side, so we can record all of their outcomes, again, uploading into a digital database that we can then refer to the patient's outcome through their continuum of care. The other items that we're trying to do is around electronic medical records, because our hospital has been around for nearly 100 years, and we have to keep notes for a minimum of 7 years. Moving into a digital space from an electronic medical records point of view is challenging, because there's not just us, there's another 36 hospitals to consider. But what we are trying to do is scan a lot of medical records, so that if we need to do case reviews or we need to get information quickly and sent to other health professionals, we have them digitally scanned, and we can now transport those around the country very, very quickly, instead of having to courier them or send them via post. So it's much more secure as well.
Very good. And are you seeing much improvement from the actual patient care element from there? If you've got 36 hospitals all collaborating, are they seeing things that are coming up? Is there lots of improvement from the outcomes perspective?
Look, I think from our hospital group perspective, we're really sort of changing the way we look at data and recording outcomes from a digital perspective. I think it's very easy from one site to look at their data and say, okay, yeah, I think we're doing okay. But it's when you put them next to each other and benchmark, you start to then see, well, okay, my colleague hospital's doing this and it's really, really good, or we're not doing so well in here. And we're starting to do that with patient feedback as well, so we can see how we're doing against our peers. So they'll have the top five in communication, and we might be sitting at number 4, so we can see which colleagues that we've got to try and be. And it's good because it all aids for better outcomes for our patients, and if it means there's a bit of healthy challenge in there too, that's good too.
I won't ask what number you're at. I'll just assume that you're at number 1. And when we talk to our nurses, we always ask, do they ever remember? They always seem to have 1 or 2 patient stories that they always stick out in their career.
Look, there are so many. As a clinician, you still go around and talk to patients every day. The most recent one was when I was a director of clinical services in this hospital. I was only in my job 3 or 4 weeks, and the hospital was progressing rehab beds for 30 mental health beds. So I had the pleasure of commissioning that in late December, and it opened its doors on the 28th of January. We are just accepting our first patients now, and we've got another 3 patients which came in today, so it's really exciting times ahead. What we do know is that there are still a required number of resources for mental health patients, and also the variety is required. So we're very, very happy to be able to offer a solution for our patients that need assistance.
And how are you seeing this sort of the relevance or the prevalence of mental health in Australia at the moment? Because obviously that's becoming a bigger issue: mental health, pressure, stress. It seems to be it definitely in England it seems to be discussed a hell of a lot more, but more recognised and more acceptable.
I think we're definitely more open about talking about mental health, and I think as health professionals, we're more open about talking about mental health and how that affects the rest of the body. And I think with talking about it and recognising the symptoms much earlier than I think we used to, and being able to deal with those issues, I think we're in a much better position now in being able to provide resources. We're all talking about mental health very, very freely across the country, and there's a number of reviews going on at the moment in terms of what resources are required, both in the public and the private and the community sectors. So we receive regular circular updates about what's going on in the community and other hospitals and what they're doing for mental health. I think it's amazing some of the resources that we're providing here in Australia now for our mental health patients. And what we try and do as a part of our rehabilitation programs is weave psychology and psychiatry and mental health services into our rehab programs. Why is that important? Because we look after a significant amount of patients that are suffering injury from workplace and traffic accidents, and a lot of patients who are suffering with an oncology based diagnosis. So mental health is a big component of what we see coming through in the patient's requirements. So if we can look after the patient holistically, it aims for a much shorter length of stay and actually treats the patient as a whole person, not just fractionally.
And how are you seeing the mental health of actual nurses? Because we're seeing, there is a bit of a, badge of honour, how nurses, sometimes you see they don't take breaks. They work those extra long hours. Are you seeing much being recognised within the actual, the nurses themselves?
Yeah, look, I think from my perspective, because I've come from the floor, I understand the pressures and the difficulties in not taking breaks. And I think one thing that we're always very, very conscious about is looking at overtime. We're making sure that we have enough staff and that we've employed enough staff to make sure that the nurses are well supported within the units. We have an employee assistance program which provides psychology access for all of our staff across the organisation, whether that be nurses, doctors, non-clinical staff, which we encourage regularly, and we extend that to our staff's family as well. It's very, very important that sometimes the stresses may cause some issues for our staff members, but it's actually the staff members' relatives that need some help, and we extend that same invitation. and registered nurses within our workforce, along with assistant in nursing, which...
For anyone who doesn't know what an enrolled nurse is, Lee, would you be able to tell us what that is?
Yeah, so it would be a Division 2 registered nurse. They used to be in the UK and probably phased out when I was about graduating in 2006. So enrolled nurses undergo a diploma of nursing. So they undergo an 18-month course, a combination of TAFE, so it would be an equivalent would be college. So you go to college for 18 months, you do some training within hospital, and so you'd be able to do most things that a registered nurse would be able to do. The only thing that they are not able to do is care planning and do the assessment part of the nursing process. So you can do the implementation and the evaluation, but the registered nurse would do the assessment and the care plans.
Superb. So you're looking to take them on to look at the challenges around the ageing workforce. Are there any other trends that you're spotting?
Yeah, look, I think apart from that, that really is what we're going to be focusing on the next little while. What we're seeing is some nurses coming into the workforce and going on and doing other things. So enrolled nurses will come in and go and train up to be registered nurses while they're working part-time. There are some nurses that will go into education, some that will want to go into higher education and also management roles. What we are seeing is that people are wanting to make a real career out of being a nurse, and that includes going to those higher management roles. So we are seeing people wanting to do postgraduate studies, and we're encouraging people to go on and do their postgraduate certs, diplomas, masters, and some are even doing their doctorates as well. So we certainly encourage that from a professional development perspective.
Superb. Well, Lee, thank you for your time today. Is there anything, obviously you sound like you're doing a hell of a lot in your job. What do you do outside of work when you've got a bit of part-time or free time, should I say?
Yeah, well, look, there is a reasonable amount of free time. I guess it's how you structure your day. But look, when I'm not sort of on the phone or in the hospital, it's usually the gym outside of work to try and keep fit and trim. But apart from that, in Melbourne, there's 2 different peninsulas here. There's one which takes you down the Great Ocean Road, which is always a great drive, great scenery. And then my personal favourite, which is the other end of the peninsula, which is where the wineries are. And there's a good 50-odd wineries here, and I can tell you it's probably some of the best wine that we've got.
Very good.
It's awesome.
How many have you gone through so far then? 50?
A few.
Lee, look, thank you for your time. I know it's late over there at the moment. Is there any message you'd like to share with our nurses that might be watching this?
Look, any nurses that are willing to come over to Australia, I definitely encourage it. It's a real experience, even if it's just for 6 or 12 months just to do a working holiday. I'd really recommend the experience. So come on and try.
Superb. Lee, thank you so much for your time today. Thank you everyone for watching The Voice of Nursing. Thank you to all our nurses and all our doctors and our allied health professionals and our carers for looking after us all, and we'll catch up with you again soon.